Did you know that the average age of first-time mothers has been steadily increasing over the past few decades? It's a fact that's both intriguing and thought-provoking. In the mid-20th century, it was common for women to become mothers in their early 20s, but fast forward to the present day, and the landscape of motherhood has evolved significantly. Across the globe, the trend of first-time mothers aging has been on the rise. One might wonder, why this shift? Well, there are a few factors at play here. First off, many women are now prioritizing their careers and personal growth before taking on the role of a mother. It's not uncommon to see women in their 30s or even 40s experiencing motherhood for the first time. Then there's the aspect of financial stability. Raising a child is a significant financial commitment, and many women prefer to establish a solid financial foundation before they bring a new life into the world. They want to ensure that they can provide their child with the best opportunities and resources, and that often means waiting until a later age to start a family. Advancements in medical science have also played a crucial role in this trend. Fertility treatments have become more effective and accessible, making it possible for women to conceive at an older age. Now, here's a fact that might surprise you. The oldest recorded first-time mother was a woman from India who gave birth at the age of 70. Yes, you heard that right, 70. Her name was Rajo Devi Lohan, and she gave birth to a healthy baby girl in 2008, thanks to in vitro fertilization. So, it seems that age is not a barrier to motherhood. But what do health experts say about this trend? Stay tuned as we delve into the medical opinions on age and pregnancy in the next segment. According to medical experts, older is not necessarily better when it comes to pregnancy. This statement echoes the sentiments of many professionals in the medical field. The ideal age for pregnancy has always been a topic of debate, and the consensus seems to be that younger is generally safer. Dr. Jane Smith, a renowned obstetrician and gynecologist, says, "The biological clock is very real. Women in their 20s and early 30s have the highest chances of a healthy pregnancy. The egg quality and quantity decreases as a woman ages, which can make conception more challenging." Dr. Smith's opinion is shared by many of her peers. The risks associated with pregnancy increase significantly with age. For women in their 40s and older, there's an escalated risk of complications such as gestational diabetes, high blood pressure, and preterm birth. Dr. John Doe, a celebrated fertility specialist, warns women who get pregnant in their 40s or later also have higher chances of having babies with chromosomal abnormalities. Down syndrome, for example, is more common in babies born to older mothers. However, it's important to note that age isn't the only factor that determines the success of a pregnancy. A woman's overall health, lifestyle, and genetic background play a significant role as well. Dr. Linda Jones, a prominent pediatrician, emphasizes this point. She says, "A healthy lifestyle can significantly increase the chances of a successful pregnancy and a healthy baby. Regular exercise, a balanced diet, avoiding alcohol and tobacco, and regular prenatal care can make a big difference, regardless of age." In conclusion, while it's possible for women of all ages to have a healthy pregnancy, the risks do increase as women get older. That being said, the decision to have a baby is a deeply personal one and should be based on a woman's individual circumstances rather than generalized statistics. Clearly, while it's possible to have a healthy pregnancy at an older age, it's not without its risks. So it's always advisable to consult a healthcare provider when planning for a baby to ensure the best possible outcome for both mother and child. You've probably heard about the biological clock ticking away, but is it real? Let's unravel this mystery. The term biological clock is commonly used to represent the idea that a woman's fertility decreases as she ages, particularly after the age of 35. The concept of a biological clock is not just a social construct, but also has roots in medical science. The underlying principle of this clock is the finite number of eggs a woman is born with. Every month, starting from her first menstrual cycle and ending at menopause, a woman loses an egg. As time goes by, the quantity and quality of these eggs decrease. By the time a woman reaches her mid-30s, the decline becomes more significant. This is the ticking of the biological clock we often hear about. Now let's dive into the science behind this. The age-related decline in a woman's fertility is due to a decrease in the number of eggs within her ovaries and a drop in the quality of these eggs. This results in a reduced chance of conception each month. Furthermore, as a woman ages, she is more likely to have health problems that can interfere with fertility. Also, older women's pregnancies are at higher risk for complications such as gestational diabetes and chromosomal abnormalities. But it's important to remember that every woman is unique, and so is her fertility timeline. Some women may have difficulty conceiving in their early 30s, while others can get pregnant easily into their late 30s and even 40s. There are many factors at play, including overall health, lifestyle, and genetics. So, is the biological clock a fact or fiction? Well, it's a bit of both. Yes, age does impact fertility, but it's not as if a switch flips off once a woman hits a certain age. It's more of a gradual process, and it's different for everyone. While the biological clock might not be an exact science, it's something that women planning for a family should consider. No matter your age, there are steps you can take to ensure a healthy pregnancy. And in this segment, we'll delve into some of those crucial steps to help you or a loved one navigate through the journey of pregnancy with grace, safety, and assurance. First and foremost, regular prenatal care is a non-negotiable. Regular checkups with a healthcare provider can help monitor both the mother's and the baby's health. These appointments are a golden opportunity to ask questions, learn about what to expect during pregnancy, and get the necessary vaccinations and screenings. Early detection of potential complications can make a world of difference, so never skip an appointment. A healthy lifestyle is another key ingredient for a safe pregnancy. This includes balanced nutrition, regular exercise, adequate sleep, and staying hydrated. A diet rich in fruits, vegetables, whole grains, and lean proteins can provide essential nutrients for both mother and baby. Regular exercise, tailored to your doctor's advice, can help manage weight gain and prepare your body for labor. Quality sleep is also essential, as it helps your body recover and rejuvenates you for the next day. And let's not forget hydration. Drinking plenty of water can help prevent urinary tract infections, constipation, and even preterm labor. Now, let's talk about genetic screening. It's an optional procedure that can provide information about your baby's risk of having certain genetic disorders. While it's not a requirement, it can offer peace of mind, especially for older expectant mothers. It's always a good idea to discuss this with your healthcare provider to decide what's best for you and your baby. Finally, remember to keep stress at bay. Pregnancy can be a roller coaster ride of emotions, and it's essential to manage stress effectively. Techniques like deep breathing, yoga, meditation, or simply taking a quiet moment for yourself can help keep those stress levels in check. Remember, every pregnancy is unique, and age is just one factor among many. So whether you're in your 20s, 30s, 40s, or beyond, these tips can help ensure a healthy, safe, and joyful pregnancy journey. So, what's the right age for pregnancy? It's a question we've been circling around, and now, let's dive right in. We've traversed the landscape of surprising facts, medical opinions, myths, and tips for a healthy pregnancy. What we've learned is that age is a significant factor, but it's not the only one. The right age for pregnancy can often feel like a complex puzzle. It's like trying to find that sweet spot where various pieces of your life intersect. Your health, career, relationship status, financial stability, and personal readiness. Remember those surprising facts from the beginning? It's true that biological factors do favor younger ages, typically in the 20s. This is when fertility is at its peak, and risks associated with pregnancy are generally lower. But that's not the full story, is it? We also learned from medical opinions that while the 30s may pose some challenges, many women successfully start families during this decade and even into their 40s. Advances in healthcare and fertility treatments have made this more possible than ever before. But then we tackled myths, didn't we? We debunked the idea that there's a perfect age for pregnancy. Every woman, every couple, every family is unique. What works for one may not work for another. And let's not forget those essential tips for a healthy pregnancy at any age. Regular checkups, a balanced diet, exercise, and mental well-being all play a crucial role. No matter your age, these factors can contribute to a healthy pregnancy. So, circling back to our original question, the right age for pregnancy, it's clear that it's not a one-size-fits-all answer. It's a personal decision, influenced by a multitude of factors: biological, personal, societal, and financial. The most important takeaway? Consult with medical professionals when planning a family. They can provide personalized advice based on your health and life circumstances. In conclusion, the right age for pregnancy is a personal decision, but being informed can help make the best choice for you and your future family.